Hello everyone. Thank you for listening to my presentation. I am from Department of Biomedical Engineering, Zhejiang University, and my advisor is Professor Ping Wang. The topic I present is Smart Electronic Nurse for the detection of exhaled breath to diagnose small intestinal bacterial overgrowth. The intestinal tract is an important digestive organ of the human body. The intestinal tract has several functions, but it is fragile and sensitive. The health of the intestinal tract is closely related to daily life. Gastroscopy or colonoscopy is very painful, but in fact, the intestinal tract is a microecology of its own, and different parts are often distributed with different types and quantities of bacteria. Many existing detection methods cannot achieve rapid and non-invasive screening. Intestinal microecology is closely related to the decomposition of food, regulation of immunity and the nervous system, and metabolic systems. At present, many international studies have found that changes in gastrointestinal microflora are often associated with many diseases, such as familial gastric cancer, which is often caused by the long-term increase of Helicobacter pylori. Many clinical gastrointestinal diseases are often closely related to changes in the flora, and our team focuses on bacterial overgrowth in the small intestine, which is called SIBO. SIBO may be caused by abnormal structure of the small intestine, immune deficiency, exotic. Common clinical manifestations include nausea, vomiting, diarrhea, exotic. The long-term bacterial overgrowth in the small intestine may lead to malnutrition, intestinal leakage, and other diseases. The current clinical diagnosis methods mainly include intestinal field aspiration, empirical diagnosis and treatment, and breath detection. Double-bladed endoscopy has defects such as strong invasiveness, limited sight, and easy contamination of sampling. Experienced diagnosis and treatment can easily lead to the abuse of antibiotics. At present, there is a lack of clinical methods for rapid and non-invasive screening of SIBO. So breath detection has attracted more and more attention. According to the process of food digestion in gastrointestinal tract, the tester needs to take a certain substrate, such as lettuce, first. After the substrate reaches the end of the small intestine, the overgrown bacteria will decompose the substrate to produce hydrogen and methane. Absorbed by the wall of small intestine, as the blood circulates to lungs, it can eventually be detected in exhaled air. We collect the exhaled gas through the airbag and use the self-developed electronic nose to detect the gas. We can obtain the results and curves of the exhaled gas. These are two internationally recognized gold standards for judging SIBO positivity. Through the two gold standard diagnostic models, we can quickly determine whether the tester has SIBO. Under normal conditions, the air pump sucks air into the instrument to clean the detection air chamber. When the sample air bag is inserted, the instrument will inject the sample and suck the gas into the metering ring first, and then switch the air pass through the soiled valve, and the air will pass through. The detection gas circuit pitches the gas into the metering ring, into the detection gas chamber. In the detection gas chamber, the concentration of carbon dioxide will be detected first, and then the gas will enter the chromatographic column for separation, and the hydrogen and methane will be detected by the sensor successfully after separation. Finally, we will get two characteristic peaks. This is the detection system we designed. This is the actual hardware diagram of the instrument, which mainly includes air switching, flow control, signal processing, gas chamber, and user interaction models. The front panel of the instrument mainly includes the sample inlet, the detachable and replaceable drawing tube, the display screen, the button, and the printing model, which can be tested according to the needs to print the result. We also designed the host computer software of the instrument, and the supporting instrument can be used in different scenarios. When in the community, the instrument can be used alone. When in the hospital department, the instrument can be connected to the host computer program for communication connection, so as to achieve calibration, detection, and analysis. Parameter adjustment and other functions can also access the case database, which is convenient for doctors to make follow-up diagnosis. After testing, we found the best detection flow. After testing, we found the best detection flow rate of the hydrogen methane sensor. It can also be seen that the calibration of the concentration of carbon dioxide can minimize the error generated by the patient during a single exhalation process. The upper right picture is the time about the change of carbon dioxide concentration in the one breath. The lower right picture is the change of the hydrogen concentration in one breath. And the accuracy of the detection can be better improved by coefficient calibration. The sensor has good performances after calibration and fitting. The carbon dioxide sensor can detect the concentration of 1% to 6%, which is convenient for us to calibrate the exhaled components of the sample. The hydrogen and methane sensors can detect gases with a concentration of 1 to 200 parts per million. And the hydrogen sulfide sensor can detect 10 to 1000 part per billion gas. After testing, it can be seen that the calibration curve and fitting curve of the sensor meet the detection standard. That's good for our detection. We also tested the actual samples. The samples number 2 was determined to be an invert sample due to the low carbon dioxide concentration and high baseline. It may probably because the tester did not fast or drink alcohol. Sample number 3 and number 15 were negative single peak and double peak samples of normal people. The 3 samples below are suspected SIBO detected by the instrument, and it can be seen that the detection curve of the suspected samples has obvious positive single or double peaks. We also followed up a patient with SIBO who presented with chronic diarrhea on the first test, with a single positive test peak. As diarrhea worsens, the segment increased significantly, suggesting that the overgrowth of bacteria in the small intestine has become a possible disease site, which may be the end of the small intestine. After treatment, the diarrhea was relieved, and it can be seen that the curve also decreased significantly, returning to the early stage of chronic diarrhea. At the same time, we also found that there is a certain correlation between age and small intestinal bacteria overgrowth, and our instrument can distinguish healthy people from patients suspected of small intestinal bacteria overgrowth. That's all of my presentation. Thanks for your listening.